Hi, my name is Ariel, and today I'm going to talk to you about Allen Cognitive Disabilities Model. So, what is Allen Cognitive Disabilities Model? It was initially developed as a framework and most recently renamed the Cognitive Disabilities Reconsidered Model. It applies to all domains of the OTPF and can be used to guide the evaluation and intervention process of occupational therapy. The main premise of this framework is that it focuses on the role of cognition, habits and routines, the effects of physical and social context, and the analysis of activity demand in occupational performance. Additionally, it looks at limitations and cognitive abilities that are affecting an individual's ability to perform daily occupations. What makes it different from other frameworks and models? It was originally founded based upon Piaget's theories of intellectual development and provides guidelines for measuring and monitoring safety, judgment, and problem solving when completing daily occupations. It uses the concepts of brain conservation and task equivalent to identify activities that have similar physical and cognitive demands. Based on this, we can determine the appropriate interventions for clients correlating with their Allen cognitive level or ACL. So, when was this framework developed? It was developed in the late 1960s by Claudia Allen. She began working on the cognitive levels at Eastern Pennsylvania Institute and observed it in clients with chronic mental illness. This provided one of the first evidence-based frames in occupational therapy for the cognitively impaired population. Who was this framework initially developed for? This theory was initially developed to support persons with cognitive disabilities. It supports this population as it allows for biological, psychological, or environmental changes to be made once an individual's maximum cognitive level has said to be achieved or is identified. So how can we as practitioners use Allen cognitive disabilities models in our occupational therapy practice? We can look at the cognitive complexity of a task and determine if that task is appropriate for that individual, and if so, in what ways does it need to be modified to be done safely and as independently as possible. Assessments that we can use to get an idea of our client's cognitive level include the ACL screen, the large ACLS, routine test inventory, cognitive performance test, and Allen's diagnostic module. We can use these assessments to determine a cognitive baseline and start planning our interventions based upon this. This is a brief overview of the Allen cognitive level. We can use this frame to assess and determine what cognitive level a client will best fit into. However, we would not use it as a permanent label, but only as a guide to provide appropriate intervention. The Allen cognitive levels allow us to give the clients that just right challenge and adapt the environment to best fit their needs and to encourage full occupational engagement. Thank you.